Hi there, what we're going to go through now is some great stretches for our lower back, which are good to be done on the floor. I've deliberately made these so there's absolutely no equipment and that it can be easily done whether you're at home or you're travelling or wherever, and can be done nice and quick and easily. Okay, so we're going to lay first of all on our back, and as always I'll be wanting you just to kind of float into the stretch. Bring your knee towards your chest and alternating. Okay, this should be a nice simple stretch for you. In through here, not holding it, you're just bringing your knee towards your chest. For some people, if you've got a dodgy knee, you'll feel more comfortable pulling it at the underside of your thigh. That's totally fine. And what you'll find is that as you're feeling more mobile, you'll get your knee towards your chest a little bit more. Knee to chest, one of the most simple, underrated stretches for the lower back. What you'll find is as you bring your knee towards your chest, your lumbar spine will press into the ground a little bit, and that just allows that small amount of mobility for our spinal segments. It also stretches the glutes and to a smaller degree the top of the hamstrings, which is all important for function of the lower back. All right, we're going to do a couple more each side. Last lot. There, and now we're going to place our feet on the ground. We're quite wide with our feet for this one. Palms nice and wide as well, and we're rocking knees to side to side. Okay, it's a nice controlled exercise. You're allowing the back hip to lift off the ground as you're rolling through, and this should create a nice rotatory force through the lower back, and it should feel really nice. It's also a really good one for people who suffer from hip tightness, as all those sections of the body are obviously interconnected. Okay, so this is a great one for people who get a little bit of low back pain if you're sitting down for long periods. So if you're watching a movie and you find yourself stiff, this one is really good at opening up those hips. Again, we're not holding these, we're just floating across. You're going as far as comfortable for you. You notice my back leg doesn't touch the ground, but for a lot of people who are a little bit more mobile than I am, they will get further down, and that's totally fine. In regards to your foot position, as you can see, my feet are nice and wide. Okay, but again, some people are more comfortable with their feet closer together, and that will change it slightly so that you get a bit more rotation through your spine. Okay, so do what feels good for you with this exercise. As with all these exercises today, you should feel nice while you're doing it. All right, we're going to do 2 more each way. 1, 2. Okay, so now what we're going to move to is a bridge where we're curling up our lower back. So you're in this position, feet slightly wider than hip width apart. I'm going to curl up my lumbar spine up like this and then roll back down. What I'm really focusing on is peeling one spinal segment off the ground at a time and then rolling it back up. This is a fantastic glute exercise, a really commonly prescribed one by physiotherapists because it's nice and safe and it's very effective. And if it's done in this patterning, you will get some lower back movement as well, which when people are wanting to train up the glutes, again, you cannot exclude one from the other. Lower back and glutes will always be well connected. Any good program that's working on the lower back will always include glutes. Curl, 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 and then curl, curl, curl on the way down. Okay, as I said, my feet are slightly wider than hip width apart, but really it's wherever's comfortable for you. Okay, we're going to do 3 more and move on to our next one. Curl, 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 and curl, curl, curl on the way back down. 2 more to go. Okay, next exercise. You start with your legs down straight. This is similar to the first exercise, except we're adding in a twist. So I'm going to bring my right knee towards my right chest, use my left arm to bring it across my left side. Okay, and bring it back down. Lift my left knee towards my left chest, right arm brings it across. My left shoulder is staying on the ground. As always with my stretches, I am not holding, I am not pushing to pain. Knee to chest, right arm on left thigh, coming across with the top part staying on the ground. Okay, it's not a whole body roll, it is a lower back rotation. Knee to chest, other arm, brings it to the other side. We're going to do 2 more each leg and then move on to the final lot of stretches. So with this routine today, most people would go through this routine a couple of times to get the right amount of stretching. So really 5 to 10 minutes should be about enough for most people. Once a day is an ideal time. This will be the last one. Depending on your symptoms. Okay, so we're now going to roll onto our tummies for our last couple of exercises. So you're here. We're going to be joining a Cobra and a Scorpion stretch. So from here, we curl up and then bring yourself back down. Then you're going to lift up that leg, up and across. And obviously the other one. So I'm bending my right knee, lifting up my right thigh just a small amount, and then I'm twisting through my lower back. Okay, down, and then we're adding in a Cobra. Okay, this is a very extension-based stretch, which means if you are suffering from facet joint irritation, which usually means pain when you're moving backwards, or extending upwards is probably a better way to put it, then you wouldn't be doing this section of the stretching. Okay, as always, if you're unsure, you're best to consult your GP or physio. Okay, but as a general rule, these stretches shouldn't be painful. So if they are, then you're best to skip this section and just do the flexion-based exercises. Rotate and rotate. With these ones, what you usually will find is after 4 or 5, you're really starting to move better through the hips and move better through the rotation, that section there. Okay. The Cobra, I find, just evens people out. Sometimes if people just do the Scorpion stretch, they will often end up almost twisted on the mat. So the Cobra just means people have a chance to realign, so their body's in a straight line as opposed to getting a little bit twisted, which can happen sometimes with the Scorpion stretch. Okay, this is going to be our last round. As I said before, in an ideal world, you would go through this whole routine twice, and you'd be doing this at least a couple of times a week as a real general program for lower back health. Thank you.